Hello, good evening. This is Mahmoud, and this video will be about the nursing station timings for the OSCE. For the three main OSCE exams: adult nursing, child nursing, and mental health nursing. So basically, this is one form of plenty that you will find on the NMC website. This is the resources page for nurses and midwives. You can have an overview or more information on the CBT or OSCE, but today we are going to talk about the preparation materials. There are announcements and updates, and then webinars that basically explains how is the test of competence, CBT and OSCE, the blueprints, where the OSCE exam centers or test centers. There are 5 centers across the UK. I'll be having my exam at Leeds Teaching Hospitals. Then we'll just go through the nursing state times. So basically, you'll go through 10 stations. The first 4 stations are API stations, or assessment, planning, implementation, and evaluation. For the adult nursing, you will find most of the procedures are for adult compared to mental health, for example, and learning disabilities nursing or the mental health nursing. It will be sorry, mental health nursing, learning disabilities, and children's nursing. These are the 4 categories of the nurses here in the UK. So you would find 11 or 12 procedures or 12 topics at the API station. But the timings are all same, regardless the scenario that you're going to have on the OSCE day at the API stations. You will have the assessment for 20 minutes, planning for 14 minutes, implementation for 15 minutes, and the evaluation station for 8 minutes. Basically, you will have one scenario, let's say about the chronic heart failure. You will have a scenario of a patient. There will be a mannequin or an actor, just to tell you the numbers or the findings where you will be communicating to during the assessment phase. And then there will be an assessor who will give you data about the patient, maybe if you need. And then basically he or she will assess you during the 10 stations. So these are the timings. There will be one of these scenarios included with Alzheimer's disease, anxiety and depression, asthma, chronic heart failure, community assessment, ectopic pregnancy, end of life, fall and fracture, hernia, homelessness, pneumonia, or the subdural hematoma. For mental health nurses, it will be either depression and suicide ideation or bipolar disorder. Same timings, as you can see. The learning disabilities nursing will go through behaviors that challenge or the Down syndrome. Again, same timings. For the children's nursing, you will have asthma or post tonsillectomy bleed. Again, these are only 2. You can see now how adult nursing has the bulky scenarios in the API station. Then you will have another four stations where you will demonstrate four skills in the skills station. So out of 10 stations, there will be four as an API, then four skills stations. Again, for the adult nursing, you will have the bulky skills compared to other categories. Here, you will find a different duration for each procedure. It was specified for each procedure. You might find from 6 minutes up to 21 minutes according to the skills that you are going to demonstrate. You'll have the administration of inhaled medication for 12 minutes, administration of suppository in 10 minutes, blood glucose monitoring, bowel assessment and catheter specimen of urine, 8 minutes each, fine bore nasogastric tube or fluid balance for four different patients, 12 minutes each, in hospital resuscitation. I have been told today that this has been removed so far. If you will still find that, it will be only for 6 minutes. And then you will have the intramuscular injection and the IV flush together with the visual and inflammatory phlebites, maybe. I'm not sure. This is a score of from 0 to 5 that tells you how is the cannula site in terms of having inflammation or filtration. We'll talk about it later. So it is 12 minutes each, nasopharyngeal suctioning for 10 minutes, nutritional assessment and oral care plan for 8 minutes, oxygen therapy for 10 minutes, pain assessment for 6 minutes, peak expiratory flow rate, pressure ulcer assessment, removal of urinary catheter, 8 minutes each, subcutaneous injection for 12 minutes, midstream urine and urine analysis for 8 minutes, wound assessment and aseptic non-touch technique for 21 minutes. This is the longest among all. For mental health nursing and learning disabilities nursing, both of them have the same skills. The administration of suppository and psychological observations, physiological observations, sorry, it is for 10 minutes. The de-escalation, nutritional assessment, reminiscence therapy, talking therapists are 8 minutes each. For the children's nursing, you will have a little bit more compared to mental health nursing, but still much fewer than the adult nursing. Almost same. You still have administration of inhaled medication, blood glucose monitoring, basic life support, fine bore, NG tube, nasopharyngeal suctioning, oxygen therapy, peak expiratory flow rate, removal of urinary catheter, subcutaneous injection. There is nothing new here in the children's nursing that you would not find in the adult. Same, it's some of the adult skills. You will have to demonstrate 4 out of these skills. So you will demonstrate 4 out of 9. Then there will be one station, only one station for the evidence-based practice. This goes for all nursing fields, adult, children, mental health or learning disabilities. And this is the same like the professional values station. So one station for professional values for all nursing fields, another station for evidence-based practice for all nursing fields. The duration is same, 10 minutes for all stations in both professional values and evidence-based practice. Again, you will have one procedure. It will be one of these: ankle sprain, autism, bedside handover, cervical screening, cranberry juice and urinary tract infections, dementia, diabetes, obesity, pressure ulcer, strain, smoking cessation, honey dressing for venous leg ulcers. You will have one of these. You will have a scenario for a patient, for example, who is for discharge. He had already, let's say, a fracture, and then you will need there is a prescription of an analgesic, for example, and he will need an evidence-based advice on how to compare between analgesics and which choice is best for that patient. And then you will have an article, a research basically. Maybe it is a clinical trial that shows the differences between different analgesics, let's say paracetamol and ibuprofen, and then this patient, it will be written in the scenario that this patient is has a history of asthma, and then it will be written in the research that research findings related contraindications of giving ibuprofen to patients with bronchospasms. So you would advise to give the patient to let the patient take paracetamol as it's safer, as he or she has a history of asthma. It will be just basic like that. You will have a separate blank paper where you will write, for example, I will the summary of this research is that it compares two different analgesics, recommending one analgesic over the other because the ibuprofen, for example, has contraindications and more side effects that is related to the patient. Then you will write that you will explain to the patient that paracetamol is safer in relation to his past history, and so on. Just simple like that. You will have 10 minutes to write these, and then you will go for the professional values station. It will be one of 15. Same, you will have 15 evidence-based practice stations, but you will take only you will undergo only one of these. Same goes for the professional values. Will you go only for one station? It will be either bullying, concealment of bed status, confidentiality, drug error, false representation, falsifying observations, falsifying timesheets, hospital food, impaired performance, until witnessed abuse. So again, there will be a scenario that, for example, let's say bullying. You are on a shift, you are on duty, and then you witnessed that your colleague is being bullied during his duty, and then the question will be, what shall you do in such situation? So your answer will be basically that you shall first recognize that this is a bullying, and then you should identify that bullying is not uh, uh, your colleague will not be able to practice safely if he is exposed to such situation, and then you would take actions. I will take actions to let my colleague feel safer, maybe in a work setting. Or so you would report this to your head or a nursing supervisor, or you'd rather take other actions for your colleague, to support your colleague, and to prevent the occurrence of that mistake. So that's all. 10 stations, professional values, one, evidence based, another one makes two, four skills, that's now six stations, and four API stations. These are the 10 stations that you are going to have on the OSCE day. Good luck.